Welcome. My name is Maggie Tevis. I'm from Seroptimist International of Novato, California, and this is Sounding Board. We are here today in the month of November 2013 to celebrate, by presidential proclamation, National Family Caregivers Month. The national theme this year is Family Caregivers, Now More Than Ever. 2 out of 5 adults in the U.S. are family caregivers, which represents an increase of 9% from 2010. Caregivers do $450 million worth of unpaid work, which enables millions of adults and children to remain safely in their homes. 15 million adults in the U.S. provide care for family members with Alzheimer's disease. The service and support provided by Marin County organizations to family caregivers is vital to maintaining and strengthening families. Caregivers need information, education, support, respite, and flexible work arrangements to manage their caretaking responsibilities. Marin County, by proclamation, encourages all residents to recognize and support the contributions of family caregivers who give their time, patience, care, and support to their family members. I have here today 3 guests: Holly Rylance, Program Director of Lifelong Medical Care, Marin Adult Day Health Center, Maria Martinez, and Patrick Crossan, both family caregivers. Holly oversees the administration and management of the Adult Day Health Center in Novato, California. With over 20 years of management experience, Holly leads a diverse, multi-tiered staff and volunteer team providing day healthcare services to individuals with significant disabilities and complex medical and mental health issues. I have often heard Holly remark that caregiving is a journey. And today she will explain to our viewers what that journey entails and how that journey is enhanced and realized by the support of the Marin Adult Day Health Center's programs and services.
I want to thank Maggie for the beautiful introduction. I'm so honored to actually participate in such an important part of what we do at our center every day, which is caregiving. But to have the opportunity to honor the family caregivers is, to me, my greatest. I'm so respectful of your roles. You're my heroes. And Maggie wanted me to talk a little bit about the journey of caregiving, and in that request, I decided I would defer to actual folks who were boots on the ground, so to speak. I will say that the journey of caregiving is unique to each individual. What makes it similar are the common stages that happen. How we all get through the twists and turns depends on what kind of education we can get about our loved one's disease or condition, how comfortable we are about asking friends for help. It's learning to be a new person in many ways. And as I said earlier, this is, to me, the peak of my work is to be able to interact with folks who are dedicating, their time, their love to their families, and in turn to the community, because this is, it takes a village, literally. I am really, really happy to be here with my buddies, Maria and Patrick. They are both caregivers, family caregivers, and their moms, in this case, both come to our center. And they've agreed to help me out on this, not an easy task. Everyone's had a big day at work, and I wanted to start with saying that 1 out of every 6 caregivers are working. They're not at home doing caregiving. You know, they are also working full time, and that's I chose one of a full-time caregiver and also a working caregiver. Maria, I'd like to just ask you a quick question about how did you come to find out about our center?
Well, first of all, I came because I work there too, and when I took on the caregiver role for my mother, it was very overwhelming. Myself as an occupational therapist, I found out of all the programs that are being offered at the center, Adult Day Health Care Center, and that's how I came about finding and immediately enrolled my mother.
Had you heard about us before in your works as an occupational therapist throughout the county?
Very small. They talked about, well, there's a center that's in Novato, but when I researched it, I found out about, wow, it has nursing care, it has physical therapy, occupational therapy, speech, and most important, transportation. One of the things about being a caregiver is thinking, well, how am I going to get my loved one there? I have to work. I have to be able to work full time and also care for my mother full time.
Yes, transportation is a hot topic in the community for all community-based agencies, actually. We're very fortunate that we're able to fund 2 of our own buses and drivers, which is so vital because the folks that we serve are very frail. They need a lot of assistance, and because so many of them have a dementia-related disorder, diagnosis, I should say, there's a high level of confusion. So having the same bus driver be able to pick an individual up every day is huge. And I am very proud of the fact that we make that a priority to maintain our own transportation. The bus drivers become, part of the team and are actually first eyes and last eyes. It's the first folks, it's the driver's the first person your folks see when they come and the last person. So I'm glad to hear that that was something. And I purposefully asked you that question. I want to ask you, Patrick, because we do have trouble being understood as what we do. Most people don't look for an adult day health center until there's a crisis. How did you come about looking into our program, Patrick?
After my mother had a hospitalization for a stroke in 2012, she had home health care, speech therapy, physical occupational therapy, and a social worker. And she had recovered about as much as she was going to, and they were withdrawing the services. And I had absolutely no idea what I was going to do because I knew my mother could not be alone. Eyes always have to be on her. And the social worker with the home health agency recommended Marin Adult Day Health Center. And that's how we became involved. And it was such a simple process, picking up the phone and talking with the social worker at the center and coming in for that initial visit. It was a visit. It was not an assessment. Although it is a medical adult day health center, when you come into the center, you don't feel like you're in a hospital or in an outpatient medical facility. You feel like you're in the community, like you're in a community center. So the intake was wonderful. very simple, and because you know exactly what you're doing, my mother was able to integrate very quickly, which was wonderful for me, because my mother was not a group kind of person. She lived in Florida in a condo. She worked out 5 days a week. She went out with friends, but she was not involved in any kinds of groups.
Yeah, it's very, so many times being on the receiving end of families and their loved ones coming in to tour, that's the most standard statement. Well, you know, mom, dad, uncle, aunt, whoever we're talking about, they don't like to participate in group activities, you know, and if you have bingo, forget it, right? So it's a leap of faith, I think, for families to walk in and say, this is actually going to be the right place. And I'm always so glad, and I ask the question, the next question is, how long did it take? Did your, you know, and you can kind of share with each other, because you probably had similar experiences having to, you know, say, this is a very different thing. I know for your mom, culturally, it was very different. There is no such thing as adult day health in Mexico, much less skilled nursing facilities.
Yes. Especially, I've been working in the community for a long time as an occupational therapist, and there's not that many centers out there that address multicultural activities. And at first I was nervous as to how my mother would take it, and she made friends, and she enjoys going to the center. There's a lot of stimuli. People are often surprised on how many activities we have, from memory cognitive strategies to physical therapy to OT, working on fine motor. And she gets to work. There's a lot of staff that speak Spanish, are able to instruct these exercises in her own language, and that makes it very helpful. And she's more active than she's ever been. And so it took her less than I thought it would be to adjust to the program, but it took her a couple weeks, and everybody was very patient with her to make her feel at home. They now know what she likes for a snack. They have it set up, and she's happy. And she enjoys her exercises.
How was your mom?
My mother acclimated rather quickly, and almost immediately enjoyed being with other people, peers, enjoyed taking part in activities. The interesting thing is my mother had a devastating stroke the month before, actually 2 months before she joined the center. And she had a lot of recovery work. And when she was finished at home with the recovery, she continued the recovery at the center. And I credit the center with the fact that my mother is able to speak and is still walking. She's a front wheel walker, but she's still walking. If she were at home and I were taking care of her at home 24/7, I don't think she would be walking. I think she would be wheelchair bound. So I'm terribly grateful for the restorative therapy that she gets. And it's interesting because the activities are designed to address person's needs, such as some of the exercises address the fine motor skills. You know, others address helping people be more active and ambulatory. And the artwork and some of the other activities allow her to access parts of her brain that she doesn't access anywhere else. So it's really a well-designed program to keep people
I love that you're saying that and sharing it, because I think that makes it more tangible for people to understand what happens, you know, when folks are here. The program, the average number of days that people come is just, you all are right there on the average, 3 days a week. And again, it includes the transportation, but in that time, about 5 hours, you're having assessments, as you know, from our nursing staff, social work, the registered dietitian, speech therapists if needed, interactions daily with all the clinical staff, and then a rich activity program. And what we call it is person-centered care. So when your moms both came in, and Maria, you spoke a little bit about the cultural competency aspect. We, as you know, because we spoke about it, we build that into the care plan. You know, each patient who comes in gets an individualized plan of care so that we can address what they're coming in with as strengths and work on them to maintain them, as well as areas that we need to improve on. So I think that in the sense that you were saying how everyone has when your mom comes in, that the activities are all specific, you know, there's so much of that, as well as the fact that then there's that group exercise called, not group exercise, but the group activity called bingo, right? And we're still playing bingo, folks. That's a fact. And why I say that is that in the cultural side of this coin, we have bingo from Mexico.
Yes.
What's it called?
Loteria.
Right.
And they love it. And we even incorporated that, and some of the participants who do not even speak Spanish love Loteria.
Right.
And they request it.
Right.
So it's just very individualized. And I can give an example. I'll use my mother. She used to write a lot, and she lost her function. And my father would like to regain that ability. And today I was observing her, and she's just writing away. And so it's just individualized. It's my father's goal. And
To get to see her write again.
To write again, even if it's just her name or just a simple recipe. She used to be a master chef. She used to cook. And just to get her to even write just a couple sentences, and she did that.
That must have felt good.
It did, it did.
Yeah.
And I said, oh, wow, I'm going to talk about it today. So
Well,
it was
thanks
great.
for sharing. Yeah, I am the luckiest person in the world because I get to see these moments every day. You know, I believe our staff is the best trained group of healthcare professionals in the area. We have a lot of arms around, you know, our participants, and you know, I'm very proud of the program and what, you know, not just the integrity of the program and the fact that we're able to integrate the health components, the social, psychosocial components, the activity, the creative therapy, but that very basic sense of community. I love it when someone comes up after a month or two and says, you know, I didn't think I was going to like it here, but I love it here. And it could be a participant, it could be a family member. So, you know, that feels really good. What do you think will happen? You know, I said something about, you know, in a journey you get to different, you know, the common stages are, you know, in planning. You know, what brought you both here to the center was time to get help for your loved ones and keep them in the home, you know, and that's what, you know, one of our goals is to provide that for families, be able to maintain their loved ones' independence, maximize their functioning, foster their independence, in fact, while they can still live at home. Because frankly, if people weren't at our center, they would be in a nursing home. So how is that for the two of you looking ahead?
For me, I often think about it. I mean, for me, it started very early. My mother ended up with a dual diagnoses at a young age, and I often thought, I never saw myself being the caregiver. I thought, okay, my mother's gonna grow old and take care of my kids. But this program, the center, has helped me maintain her in the home. It has maintained my father's health, his sanity, my sanity. It has educated me on what centers, what resources are available. Like you said, you only start searching for help when there's a crisis, and things became really bad, and where mom would end up missing, and I would get that phone call at 4 o'clock in the morning. So Dad, I thought I was going to end up taking care of both parents, but because my mother has been able to attend this center, he is healthier than ever. And
Did he have some health issues?
he had severe diabetes, high blood pressure, well on to heading to a stroke. And now he's been hardly, maybe 2
That's
through
wonderful.
medications.
That speaks to the value of this type of a program, because we're talking a lot about what the benefit is to the participant, to your moms in the program. But what we're celebrating also is the fact, that this journey of caregiving is a lot of work, and that this is the word is respite. You all receive respite during the time that your moms are at the center. How about you, Patrick? Do you look ahead much, or are you staying in the moment?
Both. I do look ahead. My mother is very frail. Her health is frail, and it's amazing that she's lasted this long. Honestly, she has severe health problems, and the only respite I get is when my mother attends the center.
Right.
That's the only time that I have to be able to do anything away from her. And as she gets more frail, at home we go out less.
Right.
So that makes the center that much more important for her and for me. And if it weren't for the center, she definitely would be in a nursing home. I credit the center with her being able to be in the home, and that's been our goal, is to have her stay at home. I think we'll, certainly be able to achieve that, and I'm so grateful for that.
Well, on a personal note, knowing your moms, they are lovely, lovely, lovely ladies, and certainly you're both in them, and they're kind of full of beans sometimes too, which makes it even more fun. But I'm listening to you, Patrick, and I need to acknowledge the fact that, and actually you too, Maria, that you both volunteer your time to help support us as well. And I really appreciate that. So when Volunteer Month comes up, we'll do it again, okay? Just kidding. And advocacy, just to kind of tie this up a little bit, you don't know that you have to become this advocate in everything for your loved one when they're sick. You become their voice. And I really want to commend you both on being so representative of what the role of caregiving is. Not the negative qualities of it, but the positive qualities of it. And that's when I say, I'm in the best position in the world, because I get to see this. I get to watch you all in action. And then I get to enjoy the lovely presence of both your moms. So thank you so much for that.
I do want to say that when we were faced with what my mother's life was going to be after she came home from the stroke, it became apparent that I was going to have to stay home. So I had to quit my job and stay home with her. But if my mother did not attend the center and stayed home with me, and I'm her son, she would not have the same quality of life that she has by attending the center. And I think that's so important for people to know, is if your loved one is medically frail, attending the center gives them a better quality of life. And I want my mother to be happy for as long as she can be happy. And I'm not enough. She needs a larger world. And that's what the center gives her, with a lot of medical support.
Right.
And my mother, she will tell you that the center saved her life. My mother choked on the tiniest bit of food, and you all saved her. You had to perform the Heimlich and save her. And my mother does not have swallowing difficulties. It was just a freak accident.
Right.
But
something we train for also.
Something you train for.
Yeah.
And all of her medical needs are met at the center. And I never worry about her when I bring her to the center.
Well,
I never have to.
We can't ask for anything more than that. No worries.
And in conclusion, I'd like to thank our guests, Holly Rylance, Maria Martinez, and Patrick Crossan, for appearing on Sounding Board. I have one last comment to our viewers. During the month of November, remember to find a family caregiver and give them a big hug. Holly and her staff would be glad to have you come and visit and tour their facilities at 1905 South Novato Boulevard. Please give Holly a call at 415-897-6884. And thank you very much.